So here we concentrate on the osteoarthritis of the knee joint. I will explain you. So this is the normal knee joint. This is the thigh bone and this is the leg bone. In between we will be having the smooth structure which is called as cartilage, and there will be like shock absorbers between the thigh bone and leg bone which are called as meniscus. So both this articular cartilage as well as meniscus will help in joint motion. Okay, so in the osteoarthritis, this cartilage, nothing but articular cartilage, gets damaged. So depending on the damage of this articular cartilage, we will categorize into mild, moderate and severe. So in the mild forms, we can treat with conservative measures like medication and proper physiotherapy, like muscle strengthening exercises, and we have to treat the risk factors like obesity, any poor muscle strength. We need to strengthen the muscles. Coming to the osteoarthritis of knee joint, how the patient presents, like what will be the symptoms to the patient. So patient present with pain as well as swelling in the knee joint, and it may accompany with the stiffness of the joint. So particularly pain will be more in the evenings, like it is nothing but exercise induced pain or activity induced pain and swelling. So pain will be more in the evenings and nights. So in that cases, how to diagnose osteoarthritis? It can be diagnosed with the simple X-rays. So in the X-rays, depending on the stages of the osteoarthritis, we can diagnose it. So in the X-rays, we can see the joint space narrowing, any lipping we call as damage of the bone, and formation of the extra bone we call as a lipping. So depending on the joint space narrowing and any extra bone formation, we can grade the severity of the osteoarthritis. So normally this is the healthy knee joint, where this is the thigh bone, this is the leg bone, and in between the both bones there will be a articular cartilage to the ends of the both bones, thigh bone as well as leg bone, and the soft structure in between the both bones is called as a meniscus. So in osteoarthritis, this articular cartilage will get damaged. It is due to repeated knee bending or active trauma, or due to improper muscle strength. Everything, the articular cartilage gets damaged. So in milder forms, there will be like partial damage to the articular cartilage. In these cases, we can treat with simple medication as well as muscle strengthening exercises. But in severe forms, where the articular cartilage gets damaged at multiple places, and very severe form of osteoarthritis, the patients will be having severe pain, severe restriction of their activity, and even they can't walk. So in these cases, there is no other alternative, we have to replace the joint. So in the severe cases, what we actually do, what is the knee replacement? Knee replacement is nothing but we will remove all the damaged part of the bone with the articular cartilage, and we will try to fix it with the artificial metal. Okay, so here this is the model showing the knee replacement implants. So this is for the thigh bone, the metal here it is for the leg bone, and in between thigh bone and leg bone we will put a soft structure which is called as a poly. So once the total knee replacement is done, many people will be having the questions about when to walk, so how long the patient should be bedridden, these things. But the beauty of the knee replacement is that immediately the next day patient can be able to walk with full weight bearing. So the main thing is, once the surgery is done, patient has to do proper physiotherapy so that he will strengthen his muscles, so that his gait and walking pattern will be normal. So post surgery he can do full weight bearing, and he has to do physiotherapy, proper quadriceps strengthening exercises to gain normal gait. So to conclude the osteoarthritis of the knee, if any patient or any person is having a knee pain with prolonged duration, or if it is hampering his daily activities, try to consult doctor as early as possible, so that we can diagnose it, the stage of the arthritis, and depending on the stage of the arthritis we can treat it. If it is in the early stages, with simple exercises and home remedies, you can stop the progressive degeneration of the joint. Suppose if it is in the severe stages, or if the patient is not able to walk, and if it is limiting his activity, daily activities, so he may require knee replacement, total knee replacement.